Okay, welcome back. I have the pleasure of interviewing Dr. Christian Subbio, a board-certified plastic surgeon, Subbio Plastic Surgery, from my hometown in Philadelphia. It's a pleasure to have Dr. Subbio on our panel. We're going to be speaking about the advancements and how to incorporate radio frequency into your practice. So, Dr. Subbio, welcome aboard. It's a pleasure to have you.
The pleasure is mine. Thanks for having me.
Explain to us, with all the new innovations out there, as a board-certified plastic surgeon, most people think of plastic surgeons as surgeons, and you'll never get rid of that. You go to medical school and you go through your general surgery, and then you go through your plastic surgery. And most people think of it as breast aug, tummy tucks, liposuction, and then we have lasers and radio frequency, and there is a new radio frequency device. I'm not going to name any specific manufacturers, but how do you incorporate radio frequency devices into your surgical practice? Is it you, mid-level providers, estheticians? How do you incorporate it?
Well, I think the first step is really figuring out, just as you mentioned, there seems to be a new device coming out every week, every month, just dozens and dozens of devices. You have to figure out which ones are actually efficacious, which ones are just smoke and mirrors and snake oil. And unfortunately, there's a lot of misinformation out there. So step one is figuring out which of those devices actually deliver the results that can bridge the gap between, non-invasive and invasive. And so once you find and figure out which is the right device for you, as you mentioned, is it going to be myself doing it? Am I going to delegate that duty? And it really depends upon which form of RF it is. Those which are less invasive, more topical, I can delegate to my nurse or esthetician, assuming that the risks are low. And if it's something that's more invasive and carries a little bit more of a risk profile, then I myself would do it.
With the inception of all these radio frequency devices, what do you choose to specialize in for RF? The face, the body, male sexual health? Which is your preference? I mean, you're a plastic surgeon, which deals on the entire body. So when you bring RF in, what do you feel you get the best results?
I really use it everywhere. That's one of the beauties of these devices. RF energy, depending on the platform, can be used from head to toe, as you mentioned. It can be used to rejuvenate the upper face, lower face, neck, body, feminine rejuvenation, all different applications. I myself, I like to specialize in, facial rejuvenation and then the body, the abdomen. Not so much the breast, but, those two areas.
Right. Do you use it in combination with other procedures like laser assisted and RF device together, or do you choose when a patient comes in, naturally, they're coming to you and they're saying, Dr. Subbio, this is what bothers me the most. And now it's up to you to determine what you feel is going to be the best efficacious result for them. How do you determine that when you bring an RF device?
It's really, number one is having a device or a couple devices which can address all of the patient's potential needs. As you mentioned, one patient might be coming about her neck, or another patient might be coming about his abdomen. So you always start with what bothers the patient, what is bringing them into your office, so you can focus on what's going to make that patient happy. Because if the patient is concerned with her lower neck and face, and I'm looking at her brow, it doesn't matter what I think, it matters what the patient thinks. So you try to find whatever's going to make them the happiest with what bothers them when they look in the mirror.
Well, dealing with the aging face, with RF devices, what do you feel is the average age patient? And then I'll get to my second question is, what do you think the most popular gender is? Because naturally with the male face, it's a little bit rougher and tougher, it doesn't bother us as much, we can hide it with a little bit of facial hair. So age and gender.
As far as age, I would say just very roughly, it's probably between 30 and 60 is the sweet spot. It's a wide sweet spot.
It's wide.
On the earlier age, if someone's in their late 20s or mid 30s, they can benefit from RF energy as a prejuvenation effect. And I don't think that's smoke and mirrors. I think there is some value to that. So you can sell it to these patients as getting ahead of the curve, preventing these changes which otherwise down the line might require surgery. Later on, 40s, 50s, 60s, once a patient's in their 70s and maybe 80s, there are limits to what these technologies can do. So, the further along you get, the further the skin changes are, that's when you start to your point earlier, you start to combine it with other therapies, because RF energy, in my experience, provides a mild to moderate result. It's never going to be a home run in and of itself, and you have to be careful with that because some companies will try to sell it that way, but it is not a home run by any means. It's a subtle result in the best of hands. So oftentimes I will combine that with laser, with liposuction, with PRP, multiple other modalities which in themselves have mild results when combined, give an additive synergistic effect, and that's when it becomes more useful for those patients who might have more significant changes.
Naturally, when this occurs, and you have some patients that are not candidates for surgery, maybe health-wise, because generally if you're not going to put them to sleep, but if you're doing something like sometimes under conscious sedation might be a different story. Do you explain that to the patient that we're introducing an RF device? It's not going to be the miracle that you're looking for. It's just going to give you a more refreshed look.
I think that is key. That's one of the most important things when it comes to selling an RF result to your patients is honesty, transparency, and setting the expectations appropriately. Because again, so many of these device reps will come to your office and they'll be showing these doctored pictures or misleading pictures with tangential lighting. It's very easy to be fooled into thinking that these devices give an amazing home run effect. So you have to be very careful when selling these to patients, prepare them that it's going to be a subtle result, because if they're prepared for that, afterwards they're going to be happy with the investment they've made. But if you're selling this as a replacement for a facelift, guaranteed they're going to be very unhappy. You're going to be getting negative reviews. It's headaches down, across the board. So honesty, transparency, it's just the right thing to do.
Do you have a patient sign a release or any type in their consent, letting them know that? Because look, we all know patient expectation is key. Mm-hmm. And you can deliver the best results that this radio frequency device can provide, and it still may not meet to the satisfaction of the patient. And they'll say, but you know what, doctor, you never told me that, and you know that you did.
Yeah, I've been there, and it's a great question. It's a very important topic. I would say that photo documentation is essential because so many times, as you know, patients forget the improvements. They look better, but then they get used to that and they forget how they looked prior. So excellent photo documentation is paramount, and having a long, honest, thoughtful discussion with the patient, setting those expectations. But like you mentioned, they often don't remember that conversation. So not only having the conversation, but documenting it so that afterwards you could show them the picture. Well, hey, look, this did effect a good change. And hey, we did talk about the potential that this is not a replacement for a facelift. So right. Documentation is key.
Knowing that, how do you choose in your busy schedule as a plastic surgeon who provides the RF treatments? Because many times plastic surgeons, cosmetic surgeons that are busy in the operating room all the time, delegate that to either mid-level practitioners vis-a-vis whether it's a physician's assistant, nurse practitioner, and even estheticians. Mm-hmm. So how do you delegate who provides that device in an RF?
It all kind of works out because I do it based on risk and the level of skill and training that one needs to effectively and safely operate the device. If the device is very safe, very easy to use, very low chance of risks, then yes, that's something I will delegate to a nurse or an esthetician. However, if it's something that does carry more risk, it works out because those treatments often lead to more dramatic results. They're a higher price point. There's, patients understand more risk, more price, more expertise, and so those are the ones that I tend to take on myself.
Do you usually try to sell a patient on RF device on packages versus a one-time treatment? Because I think, in our former practice, we've had where there's different RF devices that you do so much better if you stage the treatments.
Yeah, almost always. There's certain exceptions, like I have the InMode device, so for face tight, that's a semi-invasive treatment, so that's only going to be once, but luckily the effect is more dramatic with that device. The lesser invasive devices, always it makes more sense for me to sell a package. I have a long discussion with the patient telling them that, look, this is a stepwise approach. There are treatments out there where, aggressive chemical peels and laser peels that can have downtime for 6-8 weeks even. Or we can have an additive device that, you may have a day or two of redness, no significant downtime, and we creep towards that effect.
Great. Dr. Subbio, thank you so much for your time. We really appreciate it. I wish you the best of luck and continued success.
It's a pleasure. Thank you so much.
My pleasure. Thank you. So, that was Dr. Christian Subbio from Philadelphia, Pennsylvania, and he basically was speaking on the elevation of bringing in radio frequency devices into your practice.